My fellow Kenyans, allow me to have this conversation with you this evening about the COVID-19 situation in our country, with a special focus on our children and their education and the way they are living with us at home. On the 7th of July, that is 2 days ago, the minister made the long-awaited announcement that after consultation with the various stakeholders in government, the decision was arrived at that the education calendar would be suspended and schools would resume in January 2021 if the situation was favorable then. And at this point in time, looking at the situation we have, that is a valid decision, which I support 100%. However, a 2021 January decision to open schools is unsustainable, in my view, and I will give you my reasons why. Number one, many of us have been at home with our children because employers have been encouraging parents to work from home. Many people have been retrenched or they've been given unpaid leave. So parents were available to be at home with their children. Now that the economy is opening up, thanks be to God, many people are being recalled back to the offices. Many people are also being hired. So parents are obliged, they feel the need to go outside there and look for means of sustenance for them and their families. The end result is that our children are going to be left at home unsupervised. For the next 6 months, to me, that spells a disaster. Because many of them on the internet, for example, those who are doing online class, and they are not able to go out and do sports and activities because of the COVID restrictions. So then this lack of supervision is going to breed idleness, and I am concerned about the number of vices that can emerge because of this situation. Parental supervision is not there, and as much as many parents would want to be at home, I also understand the need for them to go out and work and catch up on life because it has been stagnant for the last 4 months. The second concern that I have is that there are children in our midst who have special needs. These children require special schools because of the special needs that they have. They have physical challenges, they have mental challenges, behavioral disabilities, and these children need a special environment in which to grow and thrive. They have been at home since March. If we do not intervene, these children will continue to deteriorate because in as much as the parents would want to, sometimes they do not have the capacity or the skill to look after these special needs children. They need to go back to their environment of care. The third reason is that many of these places that we are calling home are actually not safe places for our children to be, for our families mainly, especially when you look at our urban poor settings and some of the rural areas where our children live. Sometimes what we are calling home is actually a space to sleep and not a space to live. And these children are exposed to a lot of violence, gender-based violence, sexual molestation, drug and alcohol abuse, pornography, because they're at home the whole day. And these are vices these children who would have otherwise avoided by being in school. Like it or not, in this country, schools are a haven of peace and security for our children. In school, they are protected from many vices. They are protected from many dangers. And they have a semblance of order. So that even if the situation at home is not good, they are able to go to school and to forget all that and get some kind of environment where they can study and they can function. Now, this has been lacking, and it is going to continue for the next 6 months. It is going to be to the detriment of the children. And the fourth thing, which is also very important, is that the education sector is critical to our economy. First of all, it carries the largest budget. The number of private schools that have closed because their children are not going to school are very many. I read in today's newspaper that 300,000 teachers are at home. Some of them doing menial jobs, trying to survive because the schools are closed. Multiply that by a factor of 5, that is 1.5 million lives directly dependent on education for their children. And then we have all the structures that support education, from the printers to the publishers to the transport system to food. to security, to the banking system, there's so many people who directly rely on education for their sustenance. That whole ecology system is now on its knees because these children are at home. It cannot be. However, on the other hand, I can see Professor Magoha's point 100%. We cannot take our children back to school with a rising number of cases. Today, it was reported that there are 447 new cases. My fellow Kenyans, really, we have to do something about this situation. You and I are responsible for flattening this curve. And Prof also said that if we can show him consistently over a period of 2 weeks that the cases are dropping, he's willing to consider his decision about opening schools. So let us give it to him. And I'm sure if we want to, my fellow Kenyans, we can. How do we flatten this curve? Number one, I encourage you, all of you who need to go back to work, please go back to work. We need our economy up and running again. So go back to work, work hard, work very hard. But as you're out there hustling, please look after yourself. Do not forget your mask, wear it properly. Sanitize, hand wash, social distancing. Make sure you do the things that the government is telling us and the Ministry of Health to make sure that you do not get infected. Number two, as you're going about your business, be your brother's keeper. Share this message with everybody. Make sure everyone around you is wearing a mask and wearing it correctly. Make sure everyone around you is sanitizing, is observing social distancing. And if it's not happening, speak out. When you go to visit your people up country, if you must go, take this message to them. In the supermarket, in the churches. I think I'll have to do another video about church because it's a peculiar situation we need to think about. But even as you go to church, when they open up the communal worship in the next few days, I am urging you to please look after yourself. Churches are high risk and we don't want the cases to rise. I hear many people are saying that in 21 days the economy will be closed again and will be on lockdown. Why would you even want to imagine that that is a solution? We can avert that crisis by being careful, you and I. The third thing, that the most important thing, I really want us to look after our children. As we are going about our business, let us remember that our children are at home and let us come up with strategies of keeping them engaged. If it is Zoom class, let them be on Zoom class. If it is games and other skills that they can learn, let us think creatively of how to keep our children safe and busy when they're in school. They're used to a very busy 7 to 5 day, and now it's not happening, so they're idle. Also, let us think about the mental wellness of our children. These children are distressed, especially the standard 8s and the form 4s, who are really looking forward to transitioning to the next period of their life. And then they are told now they have to wait this year and the whole of next year. It is quite distressing. And I think we need to listen to them, to listen to what they're thinking and to what they're feeling, and try to put that into account as well. They are really affected and no one is listening to them. And the fourth thing, of course, we need to pray. We pray that whatever these efforts we are putting together will bear fruit and the numbers will come down and the infection will be contained. We do not want to overwhelm our healthcare system, because then we are not able to get the healthcare that we need, even when we go for other disease conditions. To the Ministry of Education, please be prepared so that when the cases come down, because I know Kenyans, once we decided to do something, we will do it. And these numbers will drop for sure. Please prepare for the children to come back to school, so that then it's not a situation of the disease is stable and the schools are not prepared. Yeah, I know Kenyans can do it if they want, and they are going to listen, and we are going to flatten the curve. To the Ministry of Health and to the frontline health workers, my colleagues, we are with you. Thank you for all the work that you're doing to keep us safe. And we are doing our best to make sure that these numbers do not overwhelm you. We are here advocating that people flatten the curve. We support you, and that we are also praying for you, that you keep safe and you are able to sustain the effort that you're doing. My fellow Kenyans, let us try. Let us try to flatten this curve. Let us try, as we are going outside there to work very hard, May the Lord bless the work of your hands, but please do it safely. Please look after your children. Please let us be the agents of hope. Many people are saying that the economy will be locked down. It shouldn't be. Let us not be negative. Let us be positive. And let us put everything in it to make sure that we flatten the curve, our economy picks up, we do not overwhelm the healthcare system, our children are safe, and life goes back to normal. But it has to be an intentional decision by you and an intentional decision by me. And I know that we can do it. Please share this video on your social media platforms to anybody who can listen, so that we make a concerted effort to flatten the curve. God bless you all, work hard, and stay safe.